Hi, I'm Dr. Chan here at Crown Dentistry. We've been getting a lot of questions about periodontal disease, so today I'm going to answer some of the most common questions on that topic, and hopefully it will help you to better understand some of the dangers and limitations and steps that can be taken in order to take care of periodontal disease. So periodontitis, or periodontal disease, is what happens when your gums and your bones get infected with bacteria. This is different than gingivitis. The difference is that periodontitis is underneath your gums, and it doesn't affect just the gums. It also infects the bone underneath. I like to tell our patients that our jawbone and our gums are like the foundation of a house. And in this illustration, your teeth to be the house. So it's important to have a strong foundation as well as a strong house. Periodontal disease attacks the foundation. If gum disease is left untreated, it can eat away at the bone and gum support of the teeth, eventually leading to the loss of those teeth. A scary thing about periodontal disease, sometimes people have no idea that they have it. A lot of times people will thankfully know that they have something going on in their mouth related to their gums and their bone, because either one, they'll start to notice a smell or a bad taste in their mouth. Sometimes they'll notice that their gums are bleeding more than they used to, or in really bad scenarios, sometimes they'll notice that their teeth are loose when they weren't previously loose before. If you think that you have any kind of periodontal disease, you should definitely see your dentist as soon as possible. If periodontal disease is left untreated, it can lead to infection, abscess, or the loss of teeth. Periodontal disease is caused by bacteria. A lot of infections in places other than the mouth throughout your body are also caused by bacteria. There are a couple of specific bacteria that are located in the mouth that are responsible for periodontal disease. Like any other kind of sickness, if you are healthier and your body's healthy and you have a good, strong, robust immune system, then you may be able to better resist the effects of periodontal disease, and your body may be able to fight it off. If periodontal disease is not treated in time, it will just continue to grow and progress. What that means is that periodontal disease attacks the bone that is located underneath your gums. Our jawbone is what holds our teeth in our mouth. Gums just kind of cover that bone, and they just go wherever the bone is located. If you lose bone because of periodontal disease, you can also lose gums around the teeth. Sometimes the gums will recede, and you'll see more of your tooth than you previously did before. If taken to the extreme, periodontal disease can cause the movement or the loss of your teeth. So periodontal cleaning is also sometimes referred to as deep scaling and root cleaning, or in layman's terms, a deep cleaning. What this means is that we need to go where the infection is in order to remove it and take it out of your mouth. So that means that the dentist or the hygienist will have to go deeper than where they would normally go on a general cleaning in order to remove the periodontal disease. That can be uncomfortable for people, so in these cases, we usually will use local anesthesia so that it's a procedure that's comfortable for the patient. You are able to get crowns of periodontal disease. However, we usually recommend that periodontal disease is treated first before crowns are placed. Sometimes we'll use the illustration of a house and a foundation. Think of your jawbone and your gums as the foundation and your tooth as a house. You wouldn't want to build a house if your foundation is weak or unstable. When you have periodontal disease and you try and put a crown on a tooth that has periodontal disease on it, it's like building a house on shaky ground or on an unstable foundation. So almost always we recommend that periodontal disease is treated first before crowns are noticed. So there are a couple ways that periodontal disease can be treated. One of the first and most common ways to treat periodontal disease is through deep scaling and root planing. What this essentially means is that hygienist or the dentist will go underneath the gums and clean out the areas of infection that are located either around the roots of the teeth or sitting in the pockets, the spaces in between your gums and your teeth. Potentially could be uncomfortable. So a lot of times local anesthesia is used in order to make the procedure more comfortable for you. So periodontal disease is something that is managed by regular appointments and also good oral hygiene at home on the part of the patient. Both of these things are necessary in order to control periodontal disease. The way that we at Crown Dentistry determine if your periodontal disease is cured is by taking regular measurements of your gums, or specifically, we measure the spaces in between the gums and teeth. Healthy spaces usually classified as 1 to 3 millimeters. 4 millimeters is usually a borderline periodontal disease situation, and any spaces that are 5 millimeters or greater are considered to be infected with periodontal disease. In order to determine whether or not a patient has periodontal disease or still has periodontal disease, we always check the measurements around each of the teeth and in between gums and the teeth. I hope we've been able to answer some of your questions about periodontal disease. If you have additional questions or if you're ready to take action, please give our office a call at 986-285-9678. Thank you.